Welcome. This presentation is to discuss the dental needs in children by Jasmine Klinger. A survey conducted by the CDC and Prevention NCHS, National Center for Health Statistics, was conducted in 2012, and it showed unmet needs to be higher in certain households and or family size. It suggested that most uninsured single mother parents and minorities have higher unmet dental needs. Cost-related issues are not just due to insurance coverage, but also management of dental health over time, that if postponed can be more expensive in the long run. The 2012 National Health Interview Survey collected and analyzed the data of U.S. population utilizing a broad range of topics. Participants were selected tediously and excluded anyone that was under in long-term facilities or that was in long-term care facilities with physical and intellectual disabilities, including children who were abused or neglected in correctional facilities or active duty armed forces personnel. Materials used was 4-component questionnaire with household composition section for basic demographics or relationship info, family core for socio-demographic characteristics or basic health statuses or injuries or health insurance coverage, etc. Sample adult core and sample child core is for random selected info for one adult and one child. Procedure used from the sample child record weight shows the estimates in the provided report. The samples collected suggested that non-Hispanic white, which is 67%, had slightly higher likelihood of getting their dental needs taken care of in this past 6 months compared to non-Hispanic black, 63%, and Hispanic children, 61%. So looking at the chart, the blue is the total children aged 2 to 7 that participated or where they got the results or samples from. And the green is the MET, meaning that they had met their dental needs for the period of 12 months. And the pink or red colored is the unmet. So 4 million children from 2 to 17 years of age had unmet dental needs in 2012. Along with that information was suggested that uninsured children went for a longer period of time without dental needs versus somebody with Medicaid or private insurance. With the 4 million children from 2 to 17 years of age having unmet dental needs, couple or several of them had several factors, but the main 3 is because, one, the families could not afford it. The other is the differences between being in a single parent household and a 2-parent household, and the uninsured, of course, versus the private health insurance and the Medicaid insurance. Although some insurances are providing coverage, a dental visit can still be costly. And single mother families were found interesting that had more likelihood to have their dental needs not met, slightly at 88%, which is 1,296 out of the 16,438 surveyed, rather than single father families at 5%, 127 of those out of the 2,618. The uninsured, which is 21% of the surveyed or the participants, versus the private health insurance, which is 4%, and the Medicaid insurance, which is 5%. One statistics that is always surprising is how even with the insurance, many people still cannot afford to go to the dentist. It is not a surprise that the samples collected suggested that uninsured children have a higher rate of unmet dental needs, being even insured individuals still have issues meeting their dental needs. An organization called Center for Healthcare Strategies are trying to help improve oral hygiene care access for low-income families. An article written on 2015 suggested by their organization that even though oral health care is fully covered under Medicaid's early and periodic screening, diagnostic, and treatment benefit, less than half of all Medicaid-enrolled children receive any dental service in a given year. Some of the barriers mentioned were lack of providers participating, reluctance to participate due to providers' inexperience or behavior issues with children, awareness provided to enrolled families, transportation and scheduling due to work or other barriers. Another issue that was found or suggested according to the survey is the time and the cost. So survey samples that was conducted by the NHIS suggested that as children get older, the likelihood of getting dental needs met were higher. This can be due to, as they get older and they get all their molars and all their teeth are already there, adult teeth, braces are needed around 10 to 11 years of age or 11 to 12. Or as we get older, problems occur and need more emergent needs to see the dentist. An article written in Washington Post in 2017 suggests that skipping dental routine visits is much more pricey and expensive in the long run due to accrued procedures that become necessary due to pain and damage caused on teeth over time. What's important as far as learning and reading the survey and the samples that were collected and the results is that, knowing the solutions that are possible in order to improve the dental needs that's lacking in children. Importance of these samples collected is finding the possible solutions. Like I said, as CHCS suggested, if providing more awareness of dental health provided with Medicaid, numbers may increase in the future. With the Affordable Care Act, if it may also assist in changing this number as well if it continues to provide more insurance coverage for Americans that may now afford health benefits. Education is always the key. Children are sponges of knowledge, and if they are provided with good, healthy habits at school, it may help promote suggestions to their parents in single or two-parent households in making dental visits every 6 months. Uninsured, as far as, tapping into the uninsured population, the Dental Care for Children program helps provide free dental health screenings that looks to be more in California so far than any other state, due to state law in California requiring a passing dental screen exam as part of enrollment in elementary school. But the idea hopefully can be spread nationwide. Their website is www.dentalcareforchildren.org/work/United States. And their link is on the reference. If you have any questions, feel free to send me a message and I'll be glad to reply to you as soon as I can. And here are the references. Thank you for your time.